Hi. Today I'm going to talk about 5 things about endotracheal tube. So what is endotracheal tube? It's a device to secure patient's airway. It can be inserted via nasally or orally. So you can see this is an endotracheal tube. Now, what is the material of endotracheal tube? It's made up of polyvinylchloride. The advantage is that it is an inexpensive, compatible with tissue, disposable and transparent material. The disadvantage is that it cannot be used for laser surgeries. Moving to the third thing, indications of endotracheal tube. For surgery, trachea has to be intubated to secure airway, to provide positive pressure ventilation. For non-surgical purposes like CPR, unconscious patients, patients having inadequate respiratory efforts, if we require tracheobronchial toileting in a patient having retained secretions, so endotracheal tube is used to in that conditions also. Now moving towards the fourth thing, that is the description, the most important part that I'm gonna discuss in detail. You can see this is a transparent material, as I already discussed, made up of polyvinyl chloride. This is the machine end. So there is a universal 15mm connector, you can see. Why universal? Because it is compatible with most of the standard circuits. Now moving towards the other end, that is the patient end. There is an oblique cut. You can see this is an oblique cut. This is known as the bevel. Opposite to this, there is a hole. This hole is known as the Murphy's eye. The advantage of this hole is that it can provide an alternate pathway. So if somehow this main opening gets blocked, it can provide an alternate pathway for gas exchange. So that is the importance of this Murphy's eye. Now moving to other section, that is cuff and inflation system. This cuff is low pressure and high volume. The advantage of high volume, low pressure is that tracheal ischemia, less chances of tracheal ischemia, mucosal sloughing, but the pressure has to be kept less than 25mm of mercury. So this is an advantage of high volume and low pressure cuff. Now moving towards, there is an inflation tubing that is connected to the middle of this endotracheal tube. You can see inflation line or tubing. This blue is known as the pilot balloon. There is a one-way valve system here. So you can check the cuff pressure by connecting the manometer there in the pilot balloon. You can see this transparent blue line that is moving to the entire length of this endotracheal tube. This is the radio opaque line. This blue line is the radio opaque line. It can tell us the correct positioning of endotracheal tube on X-ray. So this moves to the whole length of this endotracheal tube. You can see ID written here, internal diameter. Depending upon the gender, we select internal diameter. Usually in case of females 7 to 7.5, in case of males 8 to 8.5 for internal diameter is used. Thank you. You can see there is written here single use. That means it is a disposable. So there are markings 16, 18. These are the markings separated with 2 centimeter. You can see there is oral and nasal also written there. As I already discussed, this can be used orally and nasally also. Usually we fix the endotracheal tube at 20 to 22 centimeter in case of females, and in case of males at 20 to 23 centimeters. The internal diameter in case of pediatric patients, there is a formula: age divided by 4 plus 4.5, and there is a modified formula: age divided by 4 plus 4 will tell us what should be the internal diameter of endotracheal tube to be used in case of pediatric patients. So this was all about this endotracheal tube. I hope you will like this video and please subscribe. Thank you very much.